and other holistic approaches in the world of health. Don't miss out on the valuable information that can transform your well-being, because a healthy life is your ticket to a wealthy life.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
Alright, it's a beautiful Monday morning right here on the Remedy Dial Solutions 93.9, 23 minutes gone past the hour of 10, and I'm delighted to welcome you to yet another edition of Solutions Clinic, where we talk about everything and anything health. I hope you've had a wonderful weekend, and I hope that you've continually made your health a priority. Like I would always say, a healthy life is your ticket to a wealthy life. Welcome to the show. My name is Vic Riches. All right, this morning we are going to be talking about care for the ear and hearing loss. And our ears are remarkable organs, allowing us to experience the world through sound. From the melodies of music to the whispers of loved ones, our ability to hear enriches our lives in countless ways. However, like any other part of the body, our ears require care and attention to maintain optimal function and prevent potential issues. According to the WHO, over 5% of the world's population, or 430 million people, require rehabilitation to address their disabling hear losses, including 34 million as children. It is estimated that by 2050, over 700 million people, or 1 in every 10 people, will have a disabling hearing loss. Joining me this morning for that conversation is Dr. Chukwuma Okoli. Good morning to you, Doc. It's great to have you join us.
Thank you. Good morning.
How are you doing today?
Very well, thanks.
Awesome. So let's talk about this data. By 2050, over 700 million people globally will be having a disabling hearing problem.
Yes.
So it brings me to my first question. How then can I, as an individual, care for my ear such that I don't become a part of that number?
Thank you very much. It's simple. The statistic is alarming. And that's because we are exposed to so many things that are dangerous to our hearing and to the safety of our ears. Is it from the Bluetooth devices to earphones, and for instance, you have some people strap this small techno phones to their head and then to a radio, because they are bike men or they are people who move around.
Oh, okay. I was trying to picture you.
Yes. Or because they want to listen to programs or listen to radio
Music,
stations,
yeah.
and they are constantly strapped. Some it is earphones, and then because, okay, I'm a rider and calls can come in. You know, there are newer ways, or there are safer ways to do that. How about the people who work in clubhouses, who work in places where the speaker is always turned up? Now we always want to say, turn it up, increase the volume, let the bass boost be boom, boom. And if it's not that loud, you're not making music. These are lifestyles that are dangerous more than they are helpful. And like that statistic says, exactly by 2050, you may have 1 in 10 persons having conduction hearing loss, which is as a result of overexposure of the ears to these dangerous sounds, as it were. So that statistic is true, scary, but true.
Interesting. So basically, you're talking about noise.
Yes.
Here.
Yes.
Unfortunately, we live in an environment where you can't even escape from these kinds of noise,
Yes.
except for the one you bring to yourself, which is the use of headsets and
Yes,
headphones.
exactly.
But every now and then, you walk around the city,
Yes.
you're going to interfere with noise of
True,
different
true,
kinds.
true.
So how do you now escape what is beyond your control?
Okay. One of the things we should do is to use earplugs. Earplugs.
Is that function? Is that something people use in this country?
Well, the truth is, care about yourself. Take care of yourself. If you know you still need your ears when you are growing old, then avoid noises. Now we live in a place where you use horns to intimidate yourselves. Any little thing you start hearing people like they literally place their hands on the horn and forget the hands there. Some people use it so much like as if they don't have toys in their house. Bim, 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 and they're driving. Only they either want you to notice them or they just want to disturb the peace. Now, funnily, in my office, there's an inscription in the reception that says, "Do not make noise in this reception." And it goes. In fact, anybody who walks in, the moment you raise your voice, your attention is being brought to that notification. Do not. That is how well we protect our ears. TVs at minimal volumes, okay? In fact, sometimes I just turn off the home T. I prefer to just use the little volume coming from the TV set. So this is, it is what it is. The exposure is global. You can't do anything much about it, but you can limit how you let those sounds get in to your ears. It's either you leave the location where there's a lot of sound or you protect by using earplug. And then those things I talked about, the earphone, the Bluetooth device and all that, you can just use them for a period when you need to, and then you pull them out as fast as you can. Save your ears for your old age. It's important.
Is there a way I can know that, the said noise that we spoke of is having an impact in my ear?
Thank you.
So I'm in an environment where there are welders, there's a music theater, there's
Yes.
a lot of noise.
Yes.
Is there a way I can decipher that, this thing is beginning to affect my ear, I need to leave here?
Good. Now, imagine somebody who works in a sound music studio where the speakers are always blared. In fact, these speakers are small. I really mean they're small. Speakers that are like bodyguard as tall, and you are there for 2 hours with noise sounding, and then a need for you to step out comes, and then you step out, and then someone talks to you, and you're like, yes, you say? Soros, okay, like speak loud, I can't hear you. Even on phone, some people you have to literally shout. DJs, you have to shout, I said this. Okay, sorry, I wasn't hearing you. And you're like, and then you turn to someone nearby and say, he can't hear me. And you just said it so calmly, and the person said, I wonder something may be wrong with his ear. The moment you need people to shout around you for you to hear them, take heed. The ear problem is already by the way.
Fair enough. Let's talk about wax, because we're still going down to
Very well.
protection of the ear.
Yes.
And I have read several things about wax.
Yes.
Some would say do not remove it.
Yes.
It's protective for
Yes.
the ears. Some would say leave it there. But my question now is, whether protective or not, how as an individual can I deal with the discomforts that comes with
Thank
having
you.
wax in my ears?
Very true. There are discomforts with it. Yes, there are discomforts with it. The best is for you to see the physician and the hospital. Now, there are ways it can be removed. There is oral flushing.
Okay.
Yes. And after the flushing, some medications will be prescribed that will help. So it's best because now there are two things about this wax. They are protective, yes. Attempting to remove them with most people use cotton bud. Well, now you can actually damage the eardrum. That's one. Two, the external auditory meatus, that's the outer ear, you can actually bruise the wall. Sometimes when people over clean, they start seeing blood on the tip of the cotton wool. Yes, so the eardrum can be damaged, the wall, and then when those things are damaged, they heal by what is called scarring. Okay, like a bruise that now heals with a scar. Exactly. And when that happens, it reduces the effectiveness of the eardrum, and then hearing loss creeps in gradually. So that's why I would rather say it might be discomforting. Just get to see the physician. Let them help you with it. We also have wax impaction. That is sometimes like wax comes in various composition. For me personally, the wax in my ear is always fluidy. Soft, like butter, kind of, exactly. That's the kind of wax I have. I've seen people coming with dry crust, and like I've had to do oral flushing for them, and they'll tell you, like as if I wasn't hearing, I've just started hearing. Yes, you flush it out, remove it, and then you now give them medications to protect. In some cases, we even have people over remove, and then until you prescribe ear wax for them, that means they will have to now go and put the ear wax back before they feel normal, before they feel well again. So it's ideal to leave the earwax because it is protective of your the membrane. That's the eardrum membrane. Very important, so that someone doesn't have this conduction hearing problem very much later.
But I've also heard that, the airwax being too much in the ear
Yes.
can block the ear.
That's
as
exactly
well.
what I was talking about.
Okay.
Yes, that when it's much, it causes issue. That's what we call wax impaction. That means it blocks the ability for them to pick sounds properly. So in that situation, you let the physician review, then we will look into the ear and then do an oral flushing for them accordingly.
You've
There are
spoken
procedures
highly
for
of, going to the physician, but I mean, you and I know that not a lot of Nigerians have that luxury
That's
of
true.
visiting the hospital. So, are there ways that this can be done? I'm thinking
Okay.
the reason for producing a cotton board
Yes.
was basically to clean the air. So, why is that a problem? Other than, of course, you've mentioned the harmful process of cleaning the air, and maybe
Yes.
the board stuck into the
the
ear.
board can get stuck in the air. People get addicted to always cleaning. Now, if you are the type, someone like you now that is very clean, you always want to like, imagine I actually examined someone and her ear was like satin. Come on, I'm like, everywhere is just too clean. And then you're complaining, my ear is paining me. Like the pain was so much, we had to give her intravenous antibiotics. We had to put in antibiotics into the ear before she felt better. Very high pain reliefs. And at the end of the day, I told her, ma, the simple reason why you are having this pain is that you removed what was protecting your ear from germs, and that is the ear wax. So yes, we know people don't like going to hospital. Now, okay, these cotton boards are produced because you need to clean, but it's an habit. I would actually encourage you to go ahead putting those things into your ear because it's dangerous. Yes, it is. It is dangerous. So you have to be careful. And then it's not everyone who has this complaint, just a few people. So it's not part of what you clean daily. For instance, look at women. Their front side, every time they are bathing, someone will stick in there. I asked one lady, I said, why are you sticking your hand? What's wrong with you? What are you sticking your hand for? Okay, stick your hand and bring out your tongue and wash it. And she was looking at me, why are you so, like, come on, stop that nonsense. So if you allow, they will stick their hand to the front. Okay, stick your hand in your bum too and wash the place up. And then you want to stick your hand into your ear and clean up the eardrum. Come on. Leave those things alone. We have normal flora that are meant to protect your body from those exits because those places are exposed. So I won't come here telling you cotton bud is meant for the ear. Use it at your own risk. Anyway, if problem happen, I dare hospital.
You come and look for him. But we're even talking about cotton board, which is, somewhat fair. There are other dangerous objects that people put into their ears.
Biro cover.
Biro, keys,
car keys,
matchstick.
matchstick. Yes, matchstick.
I mean, for the excuse would be, I couldn't access a cotton board and my ears were itching, so I needed to clean it.
In those days, feather of chicken.
That feather of chicken, that one does something else to the tickling.
Yeah, so those are the things that people do, and it's crazy, though, doing that. But then one has to be careful, One has to be
But that
careful.
feather, that one looks like it's a bit safe. I don't know because it wouldn't break, It's a beer, you can hold it to.
But sir, let me tell you, you don't even know what is on that chicken's body. You don't know what the
Fair
germ the
enough.
chicken is carrying, and then you just pull the feather and you stuck it into your ear, and then those things, those germs, those worms, those insects can actually get into the brain from there. It could be fatal. One has to be careful.
Now that you mentioned germs, let's talk about ear infections.
Yes, sir.
And I think my first question will be for people who have, very wonderful fetish in the other room,
Okay.
particularly with, licking the ears, in activities and fantasies that they
Yeah.
have like that in that other room. Can one contact an ear infection
Yes, sir.
with that?
Yes, yes. One.
So first of all, let's talk about ear infections. Then you answer that can one contact an ear infection?
Yes.
Either you that is leaking or vice
Yes,
versa.
Yes, yes. Now the air can be infected. Of course, the air is opened to dust. Okay, so and then some people have the habit of always going to swim. Okay, so the pool water that is very dangerous as it is would get into the ear.
Oh,
Now,
wow.
yes, and the dangerous air too can damage. So the air can be infected either from air, okay, from air, or the ear being infected from fluids when you swim, okay, dabble into dangerous waters. So that's how infection can get in there. And when this infection comes, one has to be careful. Okay, most people just go to the OTC as over the counter, get airdrop, and start administering. Well, it's fine. You can call that a first aid, but remember, you administer that airdrop most times anyway. Anything that has to do with sense organs, people don't want to risk it. Once they notice that the eye, the ear, the skin, they want to quickly rush down to the hospital. So once you notice that you've applied these air drops and you don't feel any better, go back to the hospital and let the doctor see you and examine these ears physically. Okay, so that's it. So the infections coming through those axes I told you about, and then not commonly through the bloodstream. Now, funnily, the blood vessels that flows around the body, the ones supplying the ears are very, very tiny, and that's why this would lead me to something that many people will not expect: smoking and drinking. Yes. Now, smoking has been proven to reduce the consistency and the size of blood vessels. And I just told you now that the blood vessels supplying the ears are tiny. Now, you now reduce the space again in a tiny vessel. You are on the way to deafness, because when those blood vessels are damaged, hearing loss may develop, and it may not be reversible if it happens. So if you have not started drinking, don't start. If you've not started smoking, don't start. They could damage your ears.
Smoking and drinking are all, I mean, they have an impact in almost every part of the body
Yes,
as it is.
yes, they do.
That's crazy. Well, so basically, you're also saying that one can get infected by
Yes.
that leaking activity.
Yes. Now, going back to the leaking activity now, yes, people do get indulged in this when it happens. But then, remember, like I said, the ear is exposed, just like the mouth is exposed, just like the eye is exposed. So germs can lock in there around the pinna. That's why if you notice, the pinna has them, should I call them pathways? The way it bends in, and then the way it curls into the ear. Now you could actually leak dust from all those things, leak germs into it, and you could get into big trouble from it. So one should desist from such act.
Fair enough. I'm going to ask this question too because it's a practice that I have seen and heard. I don't know how best to put this because I'm very mindful of, if we have children listening to
Okay.
the show. But basically, some people have also used the ear as an entrance. Is that kind of pressure you apply to the ear that might lead to a problem? Do you get the picture
yes,
I'm painting?
I do.
Okay.
Yes. The ear itself, another issue that can come from the ear is balance. There's a part of the ear called Eustachian tube, which is a part that keeps balance between the ear and the mouth and gives it balance in the brain. So let's just say if an infection gets into that place, that person loses his stability balance. He won't be able to stand well because he will not be able to establish the balance between inside his body and outside the body. And so he will be feeling dizzy, drowsy, almost wanting to fall and all that. So let's establish that we must rule out any form of infection. Now, pressure too. That's why for those who have experienced bomb blasts, one thing they will tell you, actually, I've been in a place where there was a blast, and for some few days I had problem with hearing. It took a while and a lot of prayer before the hearing was restored. So, yes, the ear is an organ that hates high pressures or high impact or sounds, high sounds. So we must avoid any form of pressure to the ear because it could damage the eardrum or the middle ear. And once this part is damaged, there can't be any rectification aside going for implants and then hearing device and other things that are being used. So the ear is very delicate, and no matter what, it shouldn't be used for anything other than hearing and hearing. Well, earphones fine, but just limit the use. Headsets, limit the use. Bluetooth device, limit the use. Even if when your work needs that, sometimes it's good. That's one of the reasons why we have speakers.
Yeah.
Yes. So rather than placing the phone to the ear, some people talk about, okay, don't use the right ear, use the left ear. All of them, they have their issues. Just sometimes put the phone on speaker and talk directly into the phone rather than just placing it in your ear, especially if your job has to do with making and receiving calls and you have to be on it. Imagine somebody talking for 2 hours on phone cumulatively every day. You talk for 2 hours every day on the phone, and the phone
the
is
people
trapped.
who work as customer care representatives.
That's exactly what I'm talking about. So sometimes you might just need to put the phone on speaker and talk directly. Save your ear. Save it. Save it. You might not work in that office for life, but don't develop a disease that you will search for solution for life from working in an office for just few years.
Fair enough. Well, you're listening to Solutions Clinic this morning on the Remedy Dial Solutions 93.9 FM. I'm having a conversation with Dr. Chukwuma Okoli, and we're talking about, the care for the ear and hearing loss. So if you do have questions in that regard, you can send it to 0904 422 2939. 0904 422 2939. I also read this morning, Dr. Chukwuma, that 2 people with ear impairment are not advised to get married.
Yes.
Because it can have a genetic impact
Yes.
on their children.
Yes. Let's just say if Mr. A has a recessive gene for hearing problem and Mrs. B has also a recessive gene. Now, we all have dominant and recessive genes. Now, if the recessive gene for both comes together in a child, it will become dominant. That child may be born with a genetic hearing disability from birth. Just like we have, imagine 2 people whose glasses are like as thick as bottle, and then you see them fall in love. For me, I would be like, you guys are in love with yourself. It's good to be in love, but then do you know that you can actually still be in love with yourself when you marry separately and continue your loving and friendship stuff? Separately? Yes, for the sake of the fact that I watched the video on X, and then this little baby, the baby probably might be maybe a year thereabout, or okay, let's say at the maximum 2 years. And then they had to, even the glasses being put on her face, they had to put a strap. And the moment they put the glass, you could see she was smiling at her mom. She was so happy. And I asked myself, which means this baby was not actually seeing the mom well. And I'm like, what? So when you look at it, 2 people with hearing issues shouldn't get married because you will give rise to a child with a genetically major hearing disorder. And how would you like it when you have to go and learn sign language because you want to communicate with your child? And do you think it's easy for you that you can hear to give birth to a child who doesn't hear? Do you expect that child to get married to somebody who hears, who wants to live in a house where all you do is sign? Can you imagine? And you can talk, and then you boy be doing sign. Most times they end up with themselves, and then what are you doing? You are still keeping this gene moving from one filial generation to the other. So if you know that there are a history of hearing issues in your family, I think it's high time you put all these things into consideration, especially when love comes in and you're looking at marriage in the nearest future. It's not ideal.
So for potential couples,
Yes.
are these the ear check? Is it part of the routine that they do?
No, it's not.
It's,
It's not.
it's not.
No, it's even the eye. Those they're not
You
part
don't
of.
do that.
No, we don't do that. But then it's nothing more than the check for before pre-marriage check is no more than genotype and all that and all that, HIV status and all that. But then this is what both of you should sit down. That's why you should have a discussion. You should. I call it Sovereign National Conference. You guys sit down, bring everything to the table. Yes, I did that. In fact, up to the point of mental illness. Family history, hypertension, diabetes, we did all the check. So it's necessary that all these things are checked because imagine father diabetic, mother diabetic. Obviously, those children, by the time they are getting to 20 and above, they must be checking their blood glucose level because they could wake up tomorrow and notice that someone has a high blood sugar level. So and such a person shouldn't now go for another partner whose both parents too are diabetic. They can actually give rise to babies that will be diabetic right from their childhood. So it's not part of the pre-marriage testing, but bring these items to the discussion table. It's not just about love because love goes shallow, you go shy. Later, 2 to 3 years, everything goes shallow. But the friendship you guys will build is what will keep you going. So that and then there are many other challenges that will come up. It is the friendship you have. In fact, it is in times of silence when you look at yourself and you look at your partner and say, we are together in this, without even saying a word, and then she looks at you and say, you just said something now. Yes, I agree with you. There are times when you both have to, stand strong and face. Don't bring in unnecessary health challenges into it. I tell you, it's not a road you want to stay.
Then for children, we hear things like the child was given birth to deaf. And I would like to know what resulted into that.
Right.
And secondly, are there examinations maybe during the immunization stage of the child?
Okay.
Did they screen for hearing
Okay.
challenge too?
Now, let me
for
talk about the
children?
first one. People born deaf. Yes, I talked about it earlier while talking about the fact that people who may have recessive genes for hearing challenges, when they get married, those two recessive genes can come together and be dominant. Just like saying two AS. When they get married, they would have a mixture. The first, AA, then an AS, then the last two S's will come together, becomes an SS. So if two AS get married, in fact, if it is the dominant, if their dominant gene is the S, that means all the kids they will have may be SS. They may not even be lucky to have any AA at all.
Oh, yeah.
Exactly, or AA. So at the end of the day, you have to consider the fact that if you have a family history of hearing issue, then you shouldn't settle with somebody who has, because you could still be hearing well, and she could be hearing well. And that's why I said you need to bring everything to the table. You could be hearing well, you could be seeing well. In fact, in our family, we have one of us doesn't even use eyeglasses at all. Yet my parents, both of them use glasses. Okay, yes, I use. My elder sister does. My younger brother is permanently on it. One of us doesn't. Now, look at it. With the fact that I have history of people who use glasses around me, it's in my family, then I'll now end up in a family of somebody whose both parents uses glasses. Then what am I thinking? That means by age 1 or 2, just like the video I saw, I'll have to be looking for glasses. Well, no, it shouldn't be. So these things should be put on the table for discussion so that you don't give rise to children that will develop this problem at the very early stage of life. Yes, now going back to the second question, are there screenings? These things are done, let me use the word spontaneously. Just like the eye. I remember I have been checking up on a patient who just put to bed. And then I remember that one of these were in the sitting room. The mother was talking, and then she got up to go do something, and I could just notice the boy was looking, and then he was actually looking at her directly, but she was talking and walking away. So in the direction of the voice, his head was moving, and then he felt like he's fading away, and he started crying. Come back here, Joe. Why are you leaving me? Where are you going? And then she came back and picked him, and I was like, Ma, please, you need to breastfeed this boy. She breastfed him before he became calm. But even at that, once she's talking and passing, you keep seeing the eyes moving. So these are the things I tell mothers: be observant. Okay, at some point you will notice that the eye is moving. That means the child could see. And then sometimes, okay, for instance, one of the days that boy started crying, I just played music, and instantly, in fact, it was so fascinating for me, he stopped crying. And he was listening. It was the gospel music, and he was listening. And I was like, wow, he loves music. What does that tell me? He can hear. He can see.
Right.
So these are things that spontaneously you see them being displayed in the child. So you don't even need to check in the clinic. Mothers will tell you, once I put him down like that, he will just be tailing me up and down, and then he'll be crying to follow. Once he hears my voice, imagine some children will just hear the voice of their mom and just blare. Of course, they heard. And that's why they are calling for attention. And then you put them in front of the TV, you just notice that they will just be smiling. What are they watching? Cartoon. They can see. I remember there was one of my patients whose mother had a serious ailment, and then I was scared for the child because the ailment affects sight. Yes, she had it. She was exposed to it right from the womb because the mother had the same ailment for which we had to deliver before time. Now, this was it. Everybody was happy. Oh, the child survived. I was worried. I hope this child will be able to see because this ailment affects sight. It causes blindness. Okay, so I told the parents, please pay attention for this. And then one day the father just called me and said, in fact, that she was sleeping, and then he came inside spontaneously, just passed the comment. She woke up and then looked in his direction, and then of course tried moving the head because the child was just barely 2 weeks then. And then he went to her and then tried as if he was going to snap the finger in front of her, and she blinked. He did it again, she blinked again, and then he waved hello, and he could see her following
The
his
movement.
hands. I was so happy when they brought the child. I examined. That was when I now performed all those examinations, and they were all 100%, and I was indeed very glad. So these are things that people do spontaneously at home by checking. So, and they now notice that there is a difference or from what they expect, then they now bring for us to examine them.
Fair enough. Is it possible for something to get into the ear? I'm just thinking because if I put my hands in my ear, I see that it's the hole is quite small. I watched a very disturbing video this morning of this creepy animal inside the ear.
Oh, even big cockroach. I mean, I saw one, and I just asked myself, was he unconscious when these things were
That's the
entering?
same question I asked myself when I
kind
saw
of
the
sleep?
video.
The ear is so sensitive that just flies across my ear. My whole body is quaking. Just the fact that I hear the sound of a cockroach, or a fly or a mosquito buzzing, I'm already quaking like, God, get out of here. So how can someone stay and something will climb the pinna that is even very soft, and then, oh, come on, can't you?
When I saw this, I could not just imagine, because that's the same question everybody in the comment section. What kind of sleep
I don't
was
know.
that person sleeping to the point that thing crept in and stayed? So in when you hear, let's even move, when you hear like noise in your ear,
Yes.
what's the next line of
That's it.
action?
Now, when there are lots of noises in the ear, imagine you're in a silent room and then your ear is ringing. That's a sign that there's an ear issue coming up. Yes, yes. So one has to be careful. I've seen people go to the hospital and they got treated for something, or they use some medication, and then they suddenly turn up and say, "Doc, I'm hearing some sound. My ear is like they are ringing." I remember that I took a particular medication for malaria, and I had to leave class, sir, because the class was so loud. The noise was so loud, and the class was so quiet. I had to go home. And when I got home, I went to a mosque, the mosque at the junction of my house, and I sat there by the express. And I sat like that for 4 good days. I couldn't go to school. I needed the noise on the express and the noise from the mosque to keep me sane. Because the ringing sound in my ear is so much, I'll be having headache. So we have to be careful. If you are noticing all those sounds, it's time to get to the hospital. Let the otolaryngologist see you, or the otologist, or whatever they are, this ear specialist, let them see you, and then examine the ear to know what may be causing this sound, because it is one of the symptoms of a looming ear disorder, and it can lead to conduction deafness. Conduction deafness, yes.
Is there such a thing as partial deafness?
Yes, there is. Yes, there's partial deafness. The word deafness means a situation whereby you don't hear No, like partial deafness means it could be one ear. You know, we have two ears. Then one could be blocked, and most times those causes are basically treatable, reversible, like wax impaction, like ear scarring, and all that, from probably accident, maybe a damage to the eardrum and all that. I actually experienced that as a child. Yes, I lost my eardrum to air syringing. Yes. I was born unfortunately, in a teaching hospital, but in those days, they used to still suck and syringe the ear. So somehow, my eardrums was damaged. The left eardrum was damaged. So up until age of 16, I was deaf in my left ear. If you're talking to me, I will face you before I can hear. But well, miraculously, I got healed and I'm fine. So I make sure that I don't get exposed to things like that again. So yes, one has to be careful with how we expose ourselves to sounds, because unfortunately sound is the greatest problem that the ear has, even though the job of the ear is to hear sound, but you must regulate the sound you get exposed to and the duration of the period you get exposed to such sound again has to be regulated.
About deafness, I think you've mentioned, the reversible one.
Yes.
At what stage is, hearing loss permanent, irreversible?
Yes, we have what is called conduction deafness and then nerve.
We've spoken about that.
Yes, nerve deafness. So that's the second one. Now, when somebody has a nerve deafness, it means that the nerves that subserves hearing is damaged. That's permanent. It's permanent. At that point, you just need to look for device. So people go through surgeries. People go through hearing device, replacement of the cortical stuff, all these ear bones and all that. Well, yes, but they are not 100%. The successes around it are not 100%, but they're just managed. They're managed, yes. So one has to be careful whether conduction deafness or nerve deafness. Please, they are better. It's better you hear the story than you experience it. Yes, so please, let's be careful.
Totally agree with that. Just one question here, and
Yes,
this is
sir.
from Dyer. Good morning to you, doctor, and good morning to you, the host. My question is regarding sleep. I have difficulties while sleeping, and I have observed that the only way I sleep well is with earpiece. So I use the earpiece and I over the night till the
What?
morning. Even me, that I don't even know the medical implication. I'm just worried for you, to be honest.
No,
'Cause
sir. I understand. Have you tried putting on your home tea and putting it in the lowest volume? Do you know?
yes, there's actually an indication here. Sorry, I missed that. Yeah,
okay.
that the volume is at the BRS minimum.
Now, okay, let's just say, why did I complain that if your job is to pick phone calls, it's because of the radiation that comes from your phone to the hair, to the ear, to the head, to the brain. And the same with those things contain magnets. Yes, and they could be used as source of transmission. You could be exposed, yes. So the air bones can be damaged. The hearing organ itself can be damaged. Please, sir, do something about it. It's not safe putting on the earphone. Now, one more thing. I remember the story of a guy who died from he plugged his phone to a power bank,
Yes.
and then I don't know how he managed to leave the thing on him. I don't know what happened. It was thunderstorm and the whole thing. He got electrocuted to the extent that the
Yes.
thing got burnt and melted into his body. I hope you also remember that the person put in an earphone in his ears. So when the thunderstorm came, those wires served as the conduction for the electrical signals that killed him. So whenever you are hearing all this thunderstorm and all that lightning, and then you are strapped to your ears, you are at risk of being electrocuted. Yes.
It just reminded me of even people who put on the AirPods.
Yes.
And they just move around for days. Well,
That
what's
says it
enough
all.
for the wise?
Yes.
Because I don't know what else to say. Whew. Well, that was quite a conversation this morning. Thank you
We are
so
out of
much.
time so fast.
Thank you so much, Dr. Chukwuma Okoli,
You're
for
welcome.
such great wisdom we've, heard this morning on taking care of the ear and deafness, as it were. And I hope that you put, every knowledge that you've acquired this morning to use, because, like he said, it's better heard than experienced. That's how we draw the curtains this morning on Solutions Clinic. I'll be back next week, Monday, of course, with Doc to touch on another health subject. Like I would always say, a healthy life is your ticket to a wealthy life. Good morning to you. My name is Vic Riches.